Hello, everyone, and welcome to Couchtalk. Today, we're going to talk about Julva, the anti-aging cream for the vulva that I created out of necessity. And first, I just want to start with some testimonials. So we hear from so many women about how they have loved Julva and how well they've done with Julva. And so I want to share with you what some of the women are saying from my list. Let me tell you, you can read these on the website. Women are sharing this out loud. Veronica wrote, I love this product. It has revitalized my sex life and I'm enjoying sex more and having more orgasms. She goes, yay! Ladies, if you want to have better and more sex, I highly recommend it. Whether you have a partner or whether you have to please yourself, this product will help you enjoy better sex and having a better orgasm. Stephanie wrote that she had astounding results in 2 weeks, including stronger orgasms. She writes, I am 61 and just 4 years postmenopausal, but recently resumed intercourse with my mate after over 8 years. When I was younger, she writes, I never had problems, but now there was a pinching feeling. I talked to my healthcare provider and your product was recommended. I started using Julva 2 weeks ago and not even every night. I actually fell asleep early 2 nights. And she said the changes have been fast and astounding. Urinary leakage is almost gone. Vaginal tissues are plumped and moist, and my orgasms, which have always been great, are stronger and more complex. I have already recommended it to dozens of women and look forward to a long and happy sex life. Thank you, Dr. Anna, she writes. And I want to read this one too. She says, this is from Shelley, and states she will never be without this again. She states, I saw Julva on social media. Read up on it and read reviews. I thought, why not? I received it a few days later. There is a distinct difference in wetness, intimacy, orgasms, everything. She then writes, I ran out in November, so I thought I'd try other less expensive options. Never again. Our intimate life plummeted. She reordered about 10 days ago. She goes, I couldn't wait to apply it. We are both very satisfied. So I love these words and the sharing of stories that has come from using Julva. And I know there are a lot of questions as well. So I thought I would go ahead and answer some of those questions that I commonly get for you guys, especially since we have our Julva sale, our Summer of Love Julva sale coming on right now. So I'm going to share my screen and share with you, some answers to the commonly asked questions. So again, first, a disclaimer. As a physician, I'm Dr. Cabeca. I'm boarded in gynecology and obstetrics, as well as integrative medicine and regenerative medicine and anti-aging. And I want to let you know that with recommendations, these are recommendations and for information and education. So I hope that you find the information that I share educational, inspirational, and maybe some entertaining too, right? But I really want to inform you about your body in something that just is not talked about enough. And again, now I'm bringing attention to it around the world. I'm really starting to see the conversation happening and the suffering stopping. So that's important. So, many women, when it comes to our sexual health and vaginal dryness and loss of intimacy, we have lots of fears around it. We have lots of fears, and it could be many reasons that we lose intimacy, including, pain, discomfort. Certainly, if you have pain every time you have do have sex or do something, why would you want to, right? And that's an important thing to realize. No more powering through, ladies. Let's fix the reason for the discomfort to begin with. And specifically, as a gynecologist, I saw this over and over again, women just suffering and getting worse, not better over time. And I needed to find something natural, clean, and effective that works quickly. And so Julva. So are you guys ready to get your feminine sexy back with some libido, intimacy, pleasure, connection, pain-free sex? I will say that I tell you, when I've worked with couples that have been married for even decades and that they're able to reconnect on this intimate level, it just, let me tell you, puts the, skip in their step and the twinkle in their eye, and I love it. Sexual health, though, there's several areas of sexual health, and today I'm really going to talk more on the physical and hormonal aspects. But as in my sexual CPR program, which you guys can listen to my, Help Doctor, My Sex Drive Has No Pulse webinar at dranna.com/sexual CPR. You can definitely get some more information and some help on the relational side of things, as well as many of these other areas that we talk about. But I want to hit specifically on some of these questions. And here's one that came in from Kim. She said, I'm postmenopause and cannot have intercourse due to vaginal pain from dryness. I am heartbroken to lose that intimacy with my husband. Teresa wrote, I am concerned about incontinence. Should I use the Julva in combination with Kegel exercises? Do Kegels really help? Teresa, absolutely they do. Absolutely. And Sherry wrote, I'm 68 and the vaginal creams, estradiols just don't work. Will Julva? It's worth a try, Sherry. That's what I want to say. And let you guys know that there's a 60-day money-back, no questions asked guarantee. And even, women that have been using Julva and even had some results. Maybe it took a little bit longer to have super results, but hang in there too if you're not seeing a quick change. Sometimes it takes time and sometimes it happens very quickly. So hang in there, Sherry. And Keith wrote, hey, can it help with the libido as well? Certainly, when we increase intimacy, increase pleasure, that increases oxytocin. And of course, there are many fears that come up. So we don't want to lose this ability to have intimacy. I mean, again, it's a reason that we stay connected and we can have happy, healthy, long marriages, right? So there are definite hormonal changes that happen in the peri and postmenopause. That we have our normal changes of estrogen, progesterone, testosterone, and DHEA. I have that great ebook, What's Happening to My Hormones, that you can get at dranna.com/hormones, but just go to dranna.com or email my team and certainly read my book, The Hormone Fix, right here, The Hormone Fix, which also has a vaginal health chapter in it. And it takes more than hormones to fix our hormones. But I want to emphasize that. Other things change besides hormones. The vaginal pH, which is normally acidic, becomes a little bit more alkaline, and then there's a decline in the elasticity of the mucous membrane. So it used to be, can be really elastic, like a balloon, a stretchy balloon, or more like a tube as we lose that elasticity. So we want to gain that back, and yes, we can. And also the bacteria in the vagina changes as well. We don't want that. So, it's normal to have hormonal changes as we age, but we're living a lot longer. Doesn't mean it's because it's normal that we have to suffer, right? Like menopause is mandatory, but suffering is optional. And men and women do these transitions differently, right? We are different. We are different people. And it's not just about hormones, right? Because then everyone on thyroid hormone would be thin, everyone on testosterone would be horny, but that's just not the case. But I tell you, intimacy, connection, and communication is really key. And that's one thing I always like to say is that foreplay is so important and it starts in the morning, right? What's that way that you know that you're connected, cared about, loved, and respected? So, and that, that's one way to really communicate it. So this is a visual. If you're looking on YouTube or listening on my podcast, check out our YouTube channel because I've got some great visuals, but just to show you some changes in the uterus and ovaries and a vagina that happens just from aging. So we do see that thinning, less blood supply, right? Less secretions, less moisture, less muscle, less strength. So we see that, but it doesn't have to be this way. Now, I created Julva because in my practice, and I write about this in my blogs, certainly, is that, I saw so many women that were really struggling and wanted a natural solution, wanted something natural that they could use themselves and feel better with, that didn't have additives, didn't have GMO, didn't have estrogen in it. And that, of course, we look for things that are all natural and ideally gluten-free and toxin-free. And so, I put together ingredients that I'd used throughout my years of practice as a gynecologist and as a women's health specialist, as well as a woman, a mom, and someone who's delivered 4 babies and had, been married and been divorced. I recognize a need for natural solutions. Need I say more, right? And also young women who have been on birth control pills or have PCOS and have young symptoms early that don't necessarily need a prescription, right? That there's some natural options for them too as they get to the underlying root issues that's causing discomfort. So I created Julva with ingredients that soothes, because irritation, discomfort, frequent infections are something that's very, disconcerting and uncomfortable. Let's just say it. It's the pits. So I put in shea butter, emu oil, and coconut oil. These I've used as great emollients, and they each have own beautiful natural properties. Shea butter is so good and moisturizing. Emu oil really helps the absorption of the ingredients, and coconut oil has its natural abilities to fight yeast and just be a perfectly neutral skincare ingredient that's very, very soothing. And Julva also rebuilds. I use the alpine rose stem cells. So the stem cells from the plant of the alpine rose that grows in the Swiss Alps in these harsh conditions. And it's really just a beautiful example of womanhood, right? Blossoming in the harsh conditions that we face on a daily basis, but yet coming up looking like and smelling like a rose, right? So these plant stem cells have incredible rejuvenating properties and nourishing properties, as well as some antiviral properties that research has shown that they have. So I put this in for its cosmetic benefit as well. And then I added in DHEA. DHEA is a beautiful natural substance that's native to all of us, right? Our adrenal glands produce DHEA, and another ingredient, vitamin E, because vitamin E, again, is so emollient and good for the skin. So it really helps to condition and help to decrease some of those symptoms that we're experiencing. And with Kegel exercises, with pelvic floor exercises, we get an increase in strength and elasticity and pleasure and sensation with using Julva and pelvic floor exercises together, as well as the decrease in urinary leakage that we heard about in a testimonial. So there's many research, and I put this in my website looking at DHEA and looking at the changes, how that can help with the pelvic floor. Again, with pelvic floor exercises, we can see significant improvements in so many of the symptoms that we experience. And it's really nice to see that some of the research that was done on DHEA used intravaginally, and there's available prescription of DHEA intravaginal that was found to increase bone mineral density and to stimulate vaginal maturation without affecting the endometrium, that's the lining of the uterus, and improving well-being and libido with no negative side effects. So that's really huge. Plus, looking at DHEA in looking at it in breast cancer in animal models, it was shown to inhibit breast cancer development and growth and to stimulate bone formation yet again. So I felt safe using it in my patients who have had breast cancer. And certainly if you've had breast cancer, you need to talk with your gynecologist about what options are available for you, and your oncologist certainly, to look at those options. So I always get that question about Julva and breast cancer, and I wrote a whole blog on that too, as well as some beautiful testimonials of women that have suffered, like maybe many of you, with breast cancer as well. So we were also thrilled to know that some oncologists at Sloan Kettering have been recommending Julva to their patients too, and seeing great results. Again, look at the testimonials at our website. There's other things you can use too to help with vaginal health, like coconut oil, ghee. Definitely make sure you're getting a keto green diet with healthy fats and healthy omegas. You can make your own lubricant as well with a liquid coconut oil. I use a fractionated coconut oil and make it 50-50 with a liquid organic or pure aloe vera gel. You can blend that up yourself or just combine it, shake it into a bottle, because if you get them both liquid, and add your favorite essential oils, to that. It's a great thing that you can add. So I get the question about how I should apply Julva all the time, and I recommend just apply it with your fingers, massage it in clitoris to anus, keep it in all that tissue. If you're sensitive, just stop for 3 days. Use it on the inner thighs or the mons pubis just above your clitoris, and then gradually work down to the sensitive tissue. Julva is designed to work. If you've ever had a facial peel or started a new skincare product and see some, redness, some peeling initially, that's like get out the old, get up, let the new come in, right? So if you are having irritation, just slow down. This is designed to work, but just start back half the dose and just slower, on the outer labia or the inner thighs, and then gradually work your way closer to the labia and the perineum, clitoris to anus, right? On the vulvar area, it works perfectly. And a half of an ml is a perfect dose, and that's approximately a pea size. That's a pea size. And so when I get the questions too, like, where is the vulva? And so the vulva are the lips, like our lower lips, essentially, the lower lips, and in between the lower lips, the opening to our vaginal orifices. So, and then always get the question, the guarantee, and I mentioned that we have a 60-day no questions asked money back guarantee. And if you're having any questions at any time, email team@drAnnaCabeca.com. And what about men? Can they use Julva? I do have many testimonials of men using it on the testicles or on the penis, and they've been doing well with it. But also, just like if you're worried about your man getting some on him, it does absorb really quickly. I would say, if you apply it 5 to 10 minutes, it's going to be pretty much the majority of it will be absorbed. But again, men need 10 times as much DHEA as women, and the plant stem cells are fine. We use that in men's cosmetics too, as well as emu oil, coconut oil, shea butter. All the ingredients are safe for men and safe for women. And I get the question too, should I stop my estrogen? Should I stop my medication? No, don't discontinue. It is designed to work with and complement your current regimen. And another thing, because we go sometimes from the Amazon or we go from the Sahara to the Amazon, so the dry desert to the lush rainforest. In those cases, we can get a flourish of some yeast because it's dormant. It didn't cause the yeast infection, but if you get moisture, then there's yeast there. It will start to flourish. So again, stop the Julva for 3 days. Use a topical antifungal cream. You can use Monistat, you can use Terconazole, you can get a prescription for Diflucan, something like that, or a boric acid solution works, or just keep the area dry and then start back at, again, half the dose. So too much too soon, right? This is, again, Julva is designed to work. So sometimes you need a lot less. And for some women, it's, 1 tube of Julva is a 2-month supply, but for some women it lasts 3 months or 4 months, and some need more and it will last 1 month. So it's individual. Let the tissue heal before you start using Julva again, because you want to, again, use it on if you are irritated, you can use it on the inner thighs or the lower mons pubis area, so the hairline, and that's a good way to work on it. Just a little bonus is that I put some on my lips too to reduce those fine lines and wrinkles. So you can put some here and then upper lips, lower lips, right? Do that. I run some comparisons looking at Julva and other lubricants and vaginal moisturizing creams. And I think it's really important to look at the ingredients. We don't want petroleum-based products. We don't want things with aspartame. We don't want things that gunk up and dry up in the middle of intercourse either. So, being conscientious of what you're using really does make a difference, because some of those ingredients are hormone disruptors and can cause more problems. And additionally, Julva does not contain estrogen. If you are on estrogen, you can certainly keep using it. And I do always recommend Kegel exercises. You can use balls associated with that. So they're Lilo balls, they're jade eggs, they're, pelvic muscle exercisers. That are all options to use. And so I get questions about the cost all the time. It is $69.95 for a 60-day supply, a tube of Julva, and it lasts longer for some. Initially, I typically say it will last you 2 months. But if you're not getting results, increase the dosage. And if once you get to that therapeutic level, like where you're like, oh man, this is awesome, I feel great, then you can wean off a little bit and maybe do it 5 days a week or 3 days a week. That could be a difference. So we can see those changes. You see those changes and then maintain it so that you have perfect results for a long time, so you can enjoy your pleasure, enjoy the connection, and enjoy your body, the freedom that your body gives you. Urinary incontinence, urinary leakage can cause so much disruption for individuals over time, and we don't want any of that. So I wanted to share that with you and answer your most common questions. And always email my community, email my team, Dr. Anna at you can email me, Dr. Anna at drAnnaCabeca.com or team at drAnnaCabeca.com, and check out our Julva sale this month. So I'm excited. I'm excited for that sale. And again, all the testimonials that we get on Julva. And I hope I've answered some of your most frequently asked questions about Julva. It's certainly something that I know physicians are recommending around the country now. I was just at the Institute of Functional Medicine medical conference and met hundreds of physicians that have been recommending my product, have recommended and seen amazing results, or have heard about my product and we're now so excited to take samples for them, samples for their patients. Yep, it's a good thing. Anyway, and again, money back guarantee. So it's been a pleasure to bring this to you, to see this product just help so many people around the world, so many couples, so many women, and see the results that we're getting with this very natural solution and combination. It took me 3 years to create Julva. It took me 3 years of scientific back and forth, customizing, formulating, and reformulating, and researching to make the perfect combination that felt good, smelled good, is as natural as can be. There's no fragrances in there, and it's natural ingredients combined. So I look forward to your results, and I can't wait to hear your testimonial. So I know you know women who are suffering. So I want you to share this Couch Talk with friends that you know that may not be having the conversation or really need to, or just get a community together. When we start having a conversation about, especially about things we're uncomfortable talking about. I know I am too sometimes, but I do because it's so important. And then when you see healing occur, you're just off the chart lit up about it. So share this message and please review my podcast. Those reviews are amazing. I thank you for them. And I will see you next week on Couch Talk.